Go.
Well, welcome. Welcome, Matt. Thank you for joining us here today, everybody, for a very special health policy grand rounds with a candidate for U.S. House of Representatives, Matthew Mowers. The health policy grand rounds are part of Dartmouth-Hitchcock Health's We Care, We Vote initiative, a nonpartisan voter education program designed to educate and empower our employees to participate in the electoral process by voting in the 2020 elections. All candidates for federal and statewide office have been invited to participate, and recordings of all our discussions can be found on the Dartmouth-Hitchcock We Care, We Vote website. Today, we'll hear from Mr. Mowers, who's running to represent New Hampshire's 1st District in the United States House of Representatives. Prior to this run for the U.S. House, Mr. Mowers served as a senior White House advisor to the State Department for the Trump administration, where he worked on issues dealing with immigration and foreign policy. Mr. Mowers also previously served as the executive director of the New Hampshire Republican Party. So thank you for being here today, Mr. Mowers. I will first turn this over to you for a few comments, and then we'll look forward to engaging in some dialogue. For employees who are viewing, submit questions for Mr. Mowers using the question and answer function on your Zoom platform at any point during the discussion, and we'll try to get to those. So I'll turn that over to you.
Pam, thank you so much. And thanks for everyone at the Dartmouth-Hitchcock team for providing this opportunity. One piece of my bio that wasn't in there was actually I worked in some of our global health issues. I was actually chief of staff to Dr. Deborah Birx when we worked with Dr. Fauci and many others to implement our global HIV program in a program called PEPFAR, which is the President's Emergency Plan for AIDS Relief. The program started in 2003 at the height of the HIV/AIDS epidemic, when you had over 30 million people in the continent of Africa who are HIV positive, but less than 50,000 of them on life-saving treatment. And so 17 years later, in large part because of the commitment, generosity, and leadership of the American people, you now have over 15 million people on sustaining life-saving treatment right now. And so it was an amazing program to be part of, and they were amazing people to work with. But was always my favorite part of it, of course, was getting into the field and meeting with those on the front lines who are healthcare workers and who ran the clinics and who were working hand in glove with the populations that we serve. And so it was always a tremendous opportunity to see it there. And whether that was here in the United States or in Sekani province outside Johannesburg, South Africa, it was always an amazing opportunity. And to really just see that same passion, intelligence, and dedication brought to the job every single day by so many of all of you who really work in the healthcare profession. So thanks for what you do every day. And I look forward to the discussion ahead. Thanks.
So Dartmouth-Hitchcock's been at the front line of the COVID-19 response in New Hampshire and the region. The pandemic has greatly impacted our fiscal health, care delivery, and the communities that we serve. What steps will you take to assist with the fiscal recovery of the hospitals in New Hampshire?
Sure, it's a great concern. It was one of my concerns even, as we got through the initial shutdown phase, and we started continuing to see hospitals that were sitting empty. It was really, even to elective procedures, it was one of the concerns I had about the long-term financial picture for so many of our hospitals. So I do think we're going to have to ensure that there's some funding for hospitals in the next COVID relief package. Our community hospitals are just such an integral part to not just COVID, but obviously to the overall healthcare system. I was mentioned to Pam and others when we were just chatting before that I actually used to go to Dartmouth-Hitchcock Center in Manchester when I lived in Manchester many years ago. And so, and saw the great comprehensive care that was available. And so we need to make sure that that continues to be available for all of our citizens and residents as well. So I do think that's an important piece. Obviously, the overall goal is going to be controlling the health aspect of the pandemic. So we are going to need to continue to invest in rapid testing. It was great to see just last week that rapid tests are now available to first responders here in New Hampshire. Abbott has now designed, I think it's a $7 a test, rapid test, really important step in the right direction to be able to get people back to work in a safe and healthy environment. And so I hope that those rapid tests continue to become more readily available, including for frontline healthcare workers or for those who are working in the medical profession, because we need to make sure that they're healthy and that they're also keeping their patients healthy as well. All of that done, of course, while we continue to have investments into new therapies as well. Really excited to see the FDA's announcement about new therapies coming online and approved this past week, as well as then, of course, our continued investments into a safe and effective vaccine, which, as talking to folks who are both on the regulatory side, but also on the private sector side, the development side, do believe that we're looking at the likelihood of an FDA-approved vaccine by the end of the year, with potential rollout now to frontline healthcare workers, vulnerable populations, and a few others in the first quarter of next year, and then probably looking at a more generalized population availability right after that.
Yeah. I mean, the vaccine is exciting to all of us, and that kind of leads into my next question. One of the things we worry about with the vaccine is how do we ensure a robust supply chain of the medical supplies needed, you know, the little glass vials, the needles, the syringes, all of those things, and getting the vaccine out and distributed, which is a difficult vaccine to keep cold. How will you ensure this robust supply chain or work to do that?
Well, not only that, but based on what I've talked, and like I said, I've been, I remain close to Dr. Burks. When she was here in New Hampshire, we had a chance to meet and catch up. And based upon my conversations with her, we're really looking at 2-dose vaccine too. It's likely going to be initial with a booster 30 days later. That means we're going to need even more supplies, right? I mean, there's just it's double the number of supplies for every person. So we do need to make sure that our supply chain is ready for that when it's becoming available. I will say, based on the folks I've talked to who are in the developmental stages of the vaccine, there is a really strong working relationship with the federal government involved in this. There was talk that I heard that there was an issue with a truck that was moving some of the vaccine trials, and there was an issue on a highway. They literally sent a helicopter in from the federal government to make sure they were able to take everything into possession and get to where it needed to happen. So you are seeing them operate. It truly is warp speed. And so I want to make sure that we're ready for that supply chain. Also, by the way, looking forward, right? So, God forbid we have another pandemic. God forbid we have, future challenges with the Communist Party of China. One of the first bills I want to propose, and I've said this consistently since the spring, is to incentivize companies, especially in the biotech, biologics, and pharmaceutical manufacturing space, to move their production from China here to the United States. I think that's just in the best interest for our national security, for our health, as well as for our economic well-being, because that will create good, high-tech, high-paying manufacturing jobs here in the United States. And based on folks in the private sector I've spoken with, a lot of them have real interest in bringing that development here to New England, and we're working aggressively to get them here to New Hampshire, which I think would be good for our economy, but also, like I said, good for all the other aspects as well. But we need to be monitoring that for our overall supply chain, because we do need to be ready to move the vaccine out to the general population as quickly as it's approved so people can choose to use it.
So, we talked about helping the hospital and the healthcare system and getting this vaccine out there. But even once we do all that, there's been significant impact to our communities. And what steps would you take to address the needs of our communities during this pandemic and post-pandemic?
Sure. Well, I think first and foremost, we need to make sure, we had a conversation just a little bit earlier about concerns of people losing their health insurance from private employers if they remain unemployed, and what that means for their access to the healthcare system. And that's why I'm a big believer that we need to reopen up the Paycheck Protection Program. You've got over $100 billion sitting unutilized right now, already appropriated, but unutilized in the Paycheck Protection Program. And it's being held up candidly because of politics. It's a lot of politics going on down in DC right now. This is a program that if you took a straw poll of Congress, you'd probably get over 400 hands to go up saying that they support reopening it, and yet they can't get it done. In fact, any member of Congress right now could try to bring it to the floor through what's called through a petition, which would allow them to bring it from committee to the floor directly as a standalone bill. And yet, unfortunately, partisan politics is getting in the way of even doing that. So I think that's an important piece. I do think you're going to need to make sure that there's some state and local funding. I'm against big bailouts for states that haven't managed their pension systems well. I'm against sending money just to states that haven't been running their state well. But we should have funding available for state and local governments for all these expenditures accrued, or even some direct revenue loss because of COVID-19. We can do that. I think, if you look at the fact that we should be having FEMA reimburse school districts for purchase of PPE, which is really important, because there are going to be school districts that have kids going back to school. And we know that there's ways they can do that in a way that also protects their health and safety. But they are going to need PPE available to do that. And so those are budget constraints we don't want to put any school board under, any municipality under, or our state under as well. And so I think those are all a few pieces that we can work towards too.
Great. So the waivers and flexibilities that have been put in place by HHS and CMS during this public health crisis have removed a lot of regulatory barriers and enabled providers at Dartmouth-Hitchcock Health to provide more patient-centered care. Specifically, we enhanced our telehealth services to provide care to patients at home. Wanted to talk about what steps you'll take to ensure providers can continue to provide telehealth services. And so there's two parts to this: making sure that insurance covers telehealth to home, but also in a state like New Hampshire, making sure patients have access to broadband, whether it's just making sure that it's available and also making sure that it's affordable.
Sure. Well, no, great question. I think, what we can do from the pandemic. I mean, obviously we know all the tragedies and loss of life, and we know all the economic impact and all the problems. But if we were to look for what we've learned, one thing I think is how we can rely on expanded telehealth and telemedicine. And so that's something we worked on in our global HIV program to do. It's something that I know the VA was already actively working towards expanding as well, especially in the area of mental and behavioral health, where you've actually seen increased adherence to appointments because of the expansion of telemedicine. And so I think we should be looking for ways to make that a more permanent fixture of our healthcare system. I don't think it's going to replace our traditional healthcare system, and no one's ever going to say it would, but it is a tool that's available to cut down on travel, to cut down on costs, and to also provide more opportunities for more patients. I know, talking to a lot of folks in federally qualified healthcare centers, call I did just a couple of weeks ago, that there is a concern about the reimbursement rate from the federal government through Medicare and Medicaid on telemedicine. So that's something we are going to have to address in a way to close that gap between what they would receive on a reimbursement for a traditional visit versus what they would receive because of a telemedicine appointment. But I think we should be looking for ways to expand telemedicine and telehealth. I think it's common sense. I think it's something that we're readily available for right now. I think it's a learning lesson we can have. You're right, we do have broadband access issues, especially when you get to parts of our district in Carroll County. So we do need to work to modernize the way that the utilities work in areas like Carroll County. We do need to be looking for ways to expand broadband access, and whether that's in a public-private partnership, whether that's through some federal resources, or whether that's just identifying the fact that the internet and our telecommunications capacity are now an entity that looks a lot like heating and electricity in the way that the utilities are actually regulated. Those are all conversations we need to be having as we look forward as well. And I think it does, you're right, tie into our ability to expand telemedicine and telehealth.
Yeah, it works for the schools too. I mean, I think that's where we talk about these health inequities and disparities, and even just around education. It's great to send all the kids home and say you should have telehealth, and then if you don't have access to broadband, it's really tough.
Well, it's especially challenging as more and more students are learning from home.
Exactly.
This has been putting a big impediment on a lot of school districts to have the ability to have that type of remote learning. I'm a believer that we should, it's up to every school district and school board to take input from parents and teachers about what works best for them. But at the same token, there are a lot of districts that are going to need to have some form of remote learning for a period of time, I believe. And so we do need to make sure that these students, regardless of their community that they're in, have access and ability to do that and be part of that.
That's where you'd see that question, as I'm a pediatrician. So,
Dr. Hoffley, we have a question from our audience, if that's okay.
Okay, I'll have a peek at that.
Okay.
So one of our employees said, you mentioned partisan politics in DC. So if elected, how would you break through the partisan stalemate we currently see?
Sure. And look, I've had some experience in doing this. So when I was helping run our global health programs at the State Department, that was a program that was actually coming up for reauthorization while I was there. The dirty little secret of DC is that you don't need to actually have an authorized program to continue running. They can just hand a check over and you can run off of old authorizations. But when you're running an intricate program the way we were, that was touching so many sectors of society in so many countries, it provides you a lot of value when you're sitting across the table from the president of Uganda to be able to say, our president and our Congress have bought into our program. And so we set out, Dr. Burks and I, on getting it reauthorized, even though so many folks told us not to. In fact, Republican and Democratic appointees from past administrations said, don't bother. Congress is too partisan. Congress is too vitriolic right now. We had members of Congress tell us not to touch it. And we just didn't think that was the right thing to do. And so what we did is we actually brought a conservative Republican and a liberal Democrat together as the co-sponsors and let them see themselves and the best of themselves in the program that we were doing. And we made them the co-sponsors. And then with about 3 days before the end of the congressional session that year, we actually got reauthorized. We did it unanimously. And we did it because we actually, first and foremost, were willing to. Secondly, went out and worked and did the education necessary to members to make sure they knew that this was a program they could be proud of, regardless of how they felt about a number of other issues in society. And then we made sure that everyone was able to build consensus towards that. That's the type of thing that we can be doing in so many other areas. By the way, it doesn't mean we're all going to get along. It doesn't mean we're all going to agree all the time. We're way too expansive and diverse of a country to do that all the time. And, we often have a rosy picture in our mind of what it used to be like in the good old days. I mean, members of Congress were challenging each other to duels in 1800, right? I mean, this has not always been a place for the faint-hearted. But what they did do is at the end of the day, they got things done. And so I think we need leaders who prioritize that, leaders who don't just, say they want to be bipartisan, say they're going to be independent, but people are truly exercising independent judgment and they're looking to get things done across the aisle. I think if you have members down there who are willing to do that, you can find consensus on specific issues. The way I view it, you can probably find a majority on most topics. It's just the majority in Congress is going to look very different for every topic you go through. And so I think we need people who are looking to do that every day. And something I've done and something I look forward to doing down in Washington, D.C.
Sounds good. Many of Dartmouth-Hitchcock's patients rely on Medicare as their source of health insurance. In the September 2020 budget outlook, the Congressional Budget Office predicts that the Medicare Hospital Insurance Trust Fund will be unable to fulfill its commitments by 2024, which is a lot sooner than we had previously predicted. If you are elected to the federal office, what will you do to ensure that Medicare is available and that all seniors will be able to access the medical care they need?
Yeah, this is an important issue. And it's one that's personal because my dad's on Medicare. And believe me, I know the first phone call I'd be getting if we had problems with Medicare would be from him. And so, it's personal to me, and we need to make sure that we're doing everything we can to strengthen Medicare. It's one of the reasons I don't favor these Medicare for all approaches that have been proposed. I just don't think it's in the best interest of the general population. I also don't think it's in the best interest of those who are currently on Medicare. I think we need to be doing more to focus our attention on Medicare, strengthen the program, extend the funding source for a longer period of time, and not be talking about potentially weakening the program by a Medicare for all approach. And so, we're going to have that conversation about the best way to extend the life of that, and whether it's, providing more funding from the general fund or other measures to do that. But it's an important program. It's one that our seniors have paid into too, and they've expected to have it. So, and they continue to pay into every day. I think that's the misnomer sometimes. Everyone thinks it's a free program. It's not. It's something that folks have paid into for a long time and continue to pay into. And so that should be there for them.
Yeah, so COVID-19 has impacted a lot of Granite Staters in many ways. You actually touched on this. For many laid off or let go, it's resulted in the loss of health coverage for themselves, in many cases, their families. What policy changes would you advocate to ensure people and families are not without healthcare coverage in a time of need?
Sure. Well, I think there's a few things we can do. And, we're fortunate that here in New Hampshire, we're back down to about 5.1% unemployment. That's something that we still have a lot of work to do. I mean, if you look at pre-pandemic, we were at 2.5%, but at our peak, we were at, I believe, over 15%. So we've made some significant progress. And we've done that in a way that leads the nation in a lot of ways too. I mean, the nation is really falling behind New Hampshire in its unemployment rate. And so, a couple of things we need to do. First and foremost, is we need to make sure people can get back to work and aren't laid off, right? That's the easiest way to fix it. And that's why I support expanding and reopening the Paycheck Protection Program. That's why we do need to make sure that Governor Sununu is a big supporter of mine. He's a good friend. I want to be an ally of his in his efforts to not only keep us safe and healthy, but also get our economy going. And so working with him in a partnership to make sure that our federal policies are helping New Hampshire to make the decisions necessary to actually then, get people back to work. Those are all things that can help us on the macro level. On the specific level, and also long-term, I think there's a lot of things we can do to personalize healthcare. I think we should be, personalizing healthcare as an overall practice. First of all, reducing the cost of healthcare is an important issue. Reducing premium costs is a paramount issue. So many of our middle-class families keep getting squeezed on ever-increasing premium cost increases. But then also there's other things that can be done, like increasing the tax deductibility for health savings accounts, letting people keep more of their own money tax-free so that they can use that for routine healthcare costs or for potential catastrophic costs down the road. Things like that are things that will prepare us for the future, while we also then hopefully continue to get our economy going, get people back to work, so that we're not losing this. I mean, one of my concerns, and we talked about this a little bit earlier, Pam, was that in the height of the pandemic, when we had shutdowns, a lot of folks weren't going to the hospital. A lot of folks weren't going for routine procedures and routine checkups and screenings. And we're seeing some of the health effects of that now. Folks who are coming in with screenings and seeing later stage cancer diagnosis. That's really concerning. And so we want to make sure that folks continue to have access to their healthcare, and we need to do everything we can to close that gap while they're getting back to full employment if they are unemployed right now. But I got to tell you that the easiest way to do that is get people back to work.
Yeah, I mean, we talk about those late stage diagnoses, and that's especially a problem for people who are uninsured. The Supreme Court will hear a case related to the ACA next month. What are your thoughts on the future of the ACA? And if the court rules against it, what actions should Congress take? And I think this fits into our concern about people losing their health insurance. And as you pointed out, if you don't have insurance, even like in the pandemic, you delay care that you need, and it ends up more expensive for all of us.
Sure. Well, I support Governor Sununu's efforts in his lawsuit, which says that, we should not be repealing the ACA without a replacement. I do think we need a replacement. I think too many people are now reliant on it. I didn't necessarily support the implementation of Obamacare when it happened. I thought it had the system, the way they crafted it, had an undue impact on New Hampshire just because of our limited number of insurers. I still talk to folks who lost their healthcare plan, 6 years ago and would love to have it back. It was cheaper and they'd actually provided better coverage. I talked to a woman just the other day, actually, who for the first time in her life has been unemployed was laid off by her company last December. Now she started a sole proprietorship. She was working to bring herself back up, but as a sole proprietor, she had to shop around for health insurance. She found a high deductible plan that still cost $500 a month, which 6 years ago would have cost half that much. And so we have seen some, I think because of the individual mandate, which was in place for a long time, as well as some other pieces of the ACA, you have seen increasing healthcare costs and you have seen a lot of folks lose the healthcare plan that they wanted. So I'm not saying I support that system, but I do think we need to make sure that for those who are on either expanded Medicaid or those who have been provided access because of ACA, that there is a replacement in place that addresses those challenges so that folks don't go without healthcare. Whether it's a Supreme Court ruling, whether it's a repeal, what have you, there needs to be a solution for them. And honestly, I would love to make sure that we find a way that provides a less costly and better plan. I mean, we all know that Medicaid is not the goal for people for healthcare outcomes. It's often costs more money, and we actually see worse healthcare outcomes for those who are on Medicaid. And that goes for a number of reasons, but we also need to make sure that we're providing better care and better access. And so I'd like to figure out some tailored solutions around that. I don't promise to have all the answers today, but I think if we work together in a bipartisan way to actually develop what in my opinion, better replacement would be, I think we can figure that out.
New Hampshire's bracing itself for the silver tsunami, they call it. So baby boomers age and leave our workforce. It's imperative for New Hampshire to attract and retain young professionals, not just in healthcare, but across all sectors. This is personal for me. I'd love my kids to come back here too. How will you work to attract and retain young professionals and their families to New Hampshire?
Yeah, well, I think we can have a comprehensive conversation that involves our institutions of higher learning as well as the private sector to really figure out a pipeline. That's if you look around the country and you see a lot of these real great partnerships between our university system as well as larger private sector, and often that's in healthcare. Actually, making sure that we have students who are trained in healthcare, additional healthcare degrees that are available at UNH and Southern New Hampshire and other universities throughout New Hampshire in order to actually provide that pipeline to healthcare institutions. I think you're going to see a growth in need for those who are healthcare workers in the healthcare sector over the coming years. And that was going to happen without the pandemic. And with the pandemic, it's even exponentially more important. And so I think we can develop those partnerships. I've talked about the fact that one of the first bills I want to propose is to move, manufacturing from China here to the United States in areas of biotech development and then pharmaceutical ingredients as well as PPE. I think if we can attract some of those companies, and I know we will, because we already have some of the manufacturers and some of the distributors here in New Hampshire, let's figure out a pipeline so that between our university system, they can get linked to jobs post-graduation. Those are really integral parts I think are going to then allow people to be educated in New Hampshire, but then stay in New Hampshire once they graduate and contribute to our society and our economy and find the great New Hampshire experience that we've all had.
Hope that works and get my kids back here closer to home.
Pam, I'm going to go against my belief on federal mandates, and we're going to mandate your kids just come back.
Oh, okay. That sounds good.
We got that one handled.
So while much of the recent federal attention related to healthcare has been around COVID that we've talked about, substance use disorders continue to impact the lives of a lot of Granite Staters. What policies are you advocating for that will help the lives of those in New Hampshire struggling with addiction or mental and behavioral health issues?
Sure, and this one's personal to me as well. I've got family that struggled with addiction, and I understand the toll and impact it takes on both the person, but also their families, their friends, their communities. And so we do need to continue to treat this as an epidemic because it is. Too often we talk about opioids, but it's really not opioids just anymore. I mean, I've talked to law enforcement, I've talked to school superintendents and principals. I mean, this is expanding to, it's gone through heroin. It's now going we're having a surge in use of meth, which is really concerning because of the addictive qualities of it. So we do need to treat it as an epidemic. And I think we have two things we need to do. There's the supply and then there's the treatment. On the treatment side, I think we need to work with our state and local leaders to develop the best customized solutions. I think Governor Sununu's done a good job with the hub and spoke model he's put in place. You look at places, actually about 2 weeks within my campaign for Congress, I went and met with the folks who run the Stratford County Drug Court program, which has been recognized as a leading program and model for both first-time and repeat drug offenders, and ways to actually get them linked to treatment and help and not just incarceration. But we do need more resources to provide more inpatient and outpatient opportunities and facilities for those who do check themselves in through the hub and spoke model in particular. Too often folks are checking in right now saying, I need help. And the person on the other side of the table is saying, that's phenomenal. So glad you're here. What's your name? What's your phone number? Call back in 2 weeks. And let's see if we have a bed available. Well, I can tell you, both from personal experience with family, but also from folks I've talked to, you need to get people linked to treatment when they're ready for treatment. If you lose them in that moment, you may lose them forever. And so we need to do more to provide more opportunities to link people to treatment when they're ready for it. The second thing we have to do is address the supply side. We are seeing the influx of most of the drugs that are going into our communities, poisoning our communities, are coming from Central and South America and then through the mail in China. And this is something I worked on, and I know there's controversy around whether we need a border wall or not. But I'll tell you, based on my experience at the State Department, I spoke to folks who work in our international narcotics and law offices there. They've told me that a wall on the southern border will help prevent the inflow of illegal drugs. Because I said, I come from New Hampshire. Tell me what I need to know and where are these drugs coming from? They're coming from Central and South America across the border. They go up to Lawrence, Massachusetts, and get distributed through the rest of Northern New England. And so we need to stop that supply while we're also doing everything on the treatment side. The other thing we need to do is continue to get tough on drugs being mailed. Actually in China, it wasn't even illegal to mail fentanyl until a few years ago because we took efforts to actually encourage them to make it illegal to send fentanyl in the mail. We need to be strengthening that. There's the International Postal Union that could crack down on that even more. It's something we worked with Congress on when I was down there. Senator Portman from Ohio had a whole session on how do we crack down on the mail of illegal and illicit drugs. And a lot of it comes down the International Postal Union. So we do have to attack it from both sides.
Okay. Well, I think I appreciate your time and answering all of our questions. We've gone a little bit over, but we started a little over. So I appreciate you sticking around with us and answering these questions. It'll be an interesting time over the next week or so, and we wish you the best. And thank you for spending time with us and answering our questions.
Pam, thank you so much, and the entire team, and for everyone who's out there listening. If folks do want to learn more, visit our website, mattmowers.com. And also, I'm happy to answer any and all questions. Reach out anytime. We'll have, not just for the next 5 days of this election, but really for the next 2 years in Congress. Look forward to the working relationship, ways that we can improve our overall healthcare system and policies in our country as we tackle both this pandemic, but also make sure we have sustainable and comprehensive healthcare moving forward as well for as many as we can.
Well, thank you for spending time with us, and have a great day. And you're heading up to Laconia.
That's right. Yep. We're
Enjoy the
going to
ride.
hop in the car right from here. We'll be up in Laconia. We've got 50 stops over the next 5 days. So
Oh, goodness.
no rest, but that's okay.
Okay. Bye.
Thank you, Pam. Appreciate it.
You're welcome.